And as the tussle of wills between the Ministry of Health and service providers in the country rages on, health economists now blame the challenges that bedevil the country's health sector on the state's decision to rush the rollout. Experts say that such key components such as proper means testing mechanisms and instruments alongside premium finance mechanisms were not put in place before the implementation, resulting in the current mess. As Mary Moki tells us in the following report, the experts also warn that unless the state rethinks its strategy on the rollout, healthcare access will remain an elusive dream for millions of Kenyans across the country.
The chicken have come home to roost for the government on the rollout of the social health insurance scheme. 5 months since its rollout, the system has faced constant challenges, and experts say the seemingly beleaguered health financing is grounding to a halt. Dr. Mutaha Kangu, a health advisor to the Council of Governors, says the government mismanaged the transition and rushed the rollout before putting in place important transitional frameworks.
And rolling out before we came up with a proper proxy means testing, the premium financing system which the law provides for. And so people who cannot afford, they are assessed to pay, but they don't have money, so they can't be registered. Despite
more than 19 million SHA registrations, only 3 million Kenyans in formal employment are currently making contributions to the fund. Experts have called out the government for what they term as doublespeak by claiming that SHA would cushion Kenyans from out-of-pocket expenditures and failing to finance the primary healthcare fund. Clinical officers who mainly run these primary care networks are currently on strike, protesting exclusion from SHA. They have also taken issue with the failure to operationalize the emergency and critical care fund, exposing Kenyans to catastrophic medical expenses.
Kwa hivyo wakati wanatufungia nje, inamaanisha wale wa Kenya ambao ndio wengi wanaenda kwa zile 91% ya zile hospitali hawezi wakapata huduma.
Started rolling out before we even identified the indigents for whom the government is supposed to pay the premiums. The reforms are trying to reduce the out-of-pocket expenditure by citizens. The end result is that now many are being forced to pay out of their pocket. And we may need to pause and reflect and ask ourselves, could we have gone wrong somewhere?
A key campaign promise for Kenya Kwanza, the government promised a social health insurance framework that would shield Kenyans from out-of-pocket payments. But 5 months since the rollout, there's still no framework for means testing, leading to low collections of SHA monthly contributions. As a result, the government is unable to raise enough money to finance the scheme, falling out with service providers who have withdrawn their services.
Because of our failure to manage transition properly, health is suffering, people are suffering.
Access, quality and affordability are key pillars of universal health coverage. The ongoing crisis in the health sector, ranging from the strike by clinical officers to further threats of strike by other cadres, expose systemic failures in the rollout of SHA, making the realization of UHC an elusive dream. Mary Moki, Citizen TV.